Hey you guys, so I'm at my plastic surgeon's office out in the parking lot getting ready to go in and have my pre-op appointment. So this is where I'm going to be going over paperwork and I'm going to be discussing the actual procedure that's going to be happening and signing, asking any questions, last minute questions to the surgeon. So kind of a big deal, wish me luck, and I will recap you guys when it's over. Hey guys, so I am in the plastic surgeon's office in my cute paper shirt, getting ready for my assessment with the doctor. We'll go over the actual procedure that's going to happen. So yeah, it's funny because I remember being in this room and trying on breast implants for the first time and trying to imagine what it would be like to have better implants, better boobs with implants. And now here I am getting ready to have them taken out. Silicone breast implants. It's amazing how they're supposed to be and how they're not when they're inside your body. Crazy. So I'm going to go ahead and admit that I am fairly nervous right now. I'm nervous that I'm going to forget to ask the questions that I want to ask. Nervous about having surgery again. Nervous about the whole process of recovering and what it will be like post-surgery without implants. After having them for 3 years, I have gotten really used to having implants, so it's going to be a huge adjustment going back to not having them again. So, yeah, wish I wasn't so nervous right now. But this too shall pass. So I'm reading over my consent form. Sagging of the breast will be present after removal. The final surgery may not be apparent for at least 3 to 6 months post-op. Psychological, marital, social, financial, and sexual problems have been claimed to arise as a result of this surgery, and I'm willing to accept these risks as possibilities after surgery. Yikes. So I just went over the paperwork and signed, but some of the things here, if you can see, there's lots of side effects. Bleeding, bruising, infections, nerve injury causing numbness, scarring, swelling, loss of skin, future breast size changes, inability to breastfeed, pain, problems that come with surgery like injury to the lungs or chest. Yeah, it's pretty nerve-wracking to remind yourself of all the risks that can happen with surgery, because when I first came in to get breast implants, they told me there was a few risks, and I honestly didn't think any of them applied to me and didn't think any of them would happen to me. Like, why would it happen to me? And it did. 3 times it did. So that's why I'm getting them removed, and I'm nervous. I'm nervous about having another surgery that something else could go wrong. Like, what if I get some raging infection after this surgery? Or what if they nick a nerve and all of a sudden I don't have any feeling on one of my breasts and I'm nervous? So I think getting them out is the right thing to do for me. I'm definitely not making these videos to tell everyone they should all have their breast implants taken out, but if it's right for you and if it's something that you're thinking about doing, that's why I'm making these videos. So just maybe to put the information out there, people can think a little bit more thoroughly before they make the decision to get implants, or if they are thinking about getting them removed, just to kind of give you some things to think about. So yeah, I will update you guys a little bit more when I get home and I've had a little bit more time to think about all this and go over it all, because I am now 6 days out from surgery, and yeah. The doctor said there was a really good chance I would have drains So JP drains, if anyone's familiar with that, that collects the fluid that might be in the space where the breast implants were removed. So there's a really good chance I'll have a drain coming from each side for the first 2 or 3 days after surgery. So that's not something I've had with the other 3 surgeries. So this will be new and a little bit annoying, but if it helps my recovery, then I'm all for it. So lots going on. So I just stopped at the hospital and got my blood drawn and did my labs for the surgery. So that's done. And before that, I stopped at the store and picked up some granny bras. Whoever's had breast surgery knows you have to wear these amazingly cute, supportive grandma bras after you get surgery. So I picked out a couple of those. Not sure what size I'm gonna be after the surgery's over. So not really sure exactly how my body fat pans out with what size I'll be. So obviously my implants will be out, so I'll be much smaller than I am now. So I got 2 size bras that are much smaller than I am now. So this will be very interesting, but getting closer to being all ready for the surgery. All right, well, that's my son. So I was just going to say that so everything is done and in place for my surgery next Wednesday. I think you guys could tell that I've been having like all sorts of mixed emotions the past couple weeks. Like even thoughts like maybe I should just leave them how they are. The thought of like having no boobs after having boobs kind of sucks, but I made the decision to have them removed, and I signed all the paperwork and everything's in place, and I've paid. And I've had a few questions on my YouTube channel that I thought I would just answer here right now. I've had some questions about the cost of the surgeries. So I had to pay full price for the very first surgery, obviously. I was a new client or a new patient, and I paid for full price for breast augmentation. The second surgery, I also had to pay full price. I had decided to switch out the size of the implants with the second surgery, and because I hadn't paid for the surgeon's like special insurance, I had to pay full price for that second surgery. So I did sign up for the insurance though with the second surgery, since I knew that things could then go wrong. So I decided to do the insurance. This is Van, you guys. He's a biter. Ah, no bite. So the third surgery, I didn't have to pay full price. I had to just pay like the anesthesia fees basically, and everything else was covered. And so now with this fourth surgery, it's the same situation. The insurance that I had paid for with the second surgery is still in place, and I don't have to pay full price. The surgeon's basically doing it for free. But I do have to pay the anesthesia fees and the lab fees. So that's a lot cheaper though than paying full price. And it's why I'm going to be using the same surgeon that I've used all along. I don't think that my surgeon did anything wrong, and I don't think this is his fault. I think this is my body's way of saying, hey, I don't want implants inside me. And so I don't have any fear about using my same surgeon. I actually really like and trust my surgeon, and I think he does have my best interest at heart. So that's what's most important to me. And so now I'm just focusing on getting this surgery behind me and healing from it, and just praying that everything goes well and goes smoothly with this surgery. But in all reality, I feel like there's 2 things I want to say about implants. One, when did we decide as women to allow society and our culture to tell us that we need breast implants to be better or more beautiful? Since when did we decide that women shouldn't be just the way that they are? Like, I mean, United States is really the one country in the world where breast implants are like so popular. If you go to a lot of the other countries, especially like the European countries and stuff, they're not popular. I don't know. I think women's bodies are more appreciated for the way that they are in other countries, and they are not appreciated for the way they are in America. And we now live in this world, in this society in America, where we're telling women to get surgery
and change your bodies to be better, and that you're not good enough the way that you are. That you have to have surgery, you have to have implants, you have to have Botox, you have to have lip injections, all of those other things I've never had, thank goodness. But I just feel like we've gone way too far in society telling women that it's not enough, and it's all just for the benefit to make money from these other people and these other companies. And I think it's time we all just take a stand and say, hey, you know what? Our bodies are freaking good enough, and we were made beautifully. And if you are a woman who prides yourself in being healthy and taking care of your body, then why should we be doing all of these other things to it? Implants, injections, surgeries are not health. They're not health. They are only for looks. And I think that's the moral of the story here that I want to share. And I really, I've learned it for myself. You know, I went through a really bumpy road, 4 surgeries later, and pain and lots of money wasted for something that was completely vain. And I wish it didn't matter. I wish I wasn't in the fitness industry, or I wish the fitness industry didn't tell women that they had to have implants. They don't say that out loud, but they say that in every other way. So, I will totally keep you guys updated. I'm going to be filming a lot the day of surgery. I'm going to be like, you know, getting off of anesthesia. So that will be really interesting. But I'm excited to take you guys on this journey and to film it and to let you guys see kind of like the inside detail of what this is like for me. And I really appreciate your guys' support. So thank you so much, and I will see you guys in a week. Just kidding. I wanted to just show you guys. This is with implants. They'll be gone next week. Yeah, it'll be interesting. But we'll make do. It'll be all right. So, health is way more important. So, no matter the only thing I'm really stressed about here is that my bum is going to be way bigger than my chest. That's kind of why I got the implants to begin with, but that's okay. Fitness life.